Hello, it's Dr. Gay from First Look MRI, and this is a 33-year-old male who injured his knee about 8 months ago. He injured it in the back, and over time it has not gotten any better. He now feels some soft tissue fullness back there and some knee pain, and so he came in for an MRI, and his knee joint looks very good. This is the front, the kneecap, as it glides along here in the front of the femur. There's no abnormality here in the front. This is the anterior knee compartment. This is the quadriceps and patellar tendons that come off the kneecap look great. If we roll to the medial side of the knee, this looks fantastic. This is the medial femoral condyle, nice cartilage. The medial meniscus looks good. Same on the lateral side. Normal lateral compartment, normal lateral meniscus. ACL looks good. So the knee joint looks fine, but in the back here, we see the medial gastrocnemius muscle comes up, and normally it tapers and attaches up here, but this is too large. So it looks like that muscle is expanded or infiltrated. It comes way up here, so this is abnormal. On this view, we can see the lesion back here, this irregular area that's mixed signal, has these sheet-like areas of low signal that look like they represent fibrosis, and these areas that are more intermediate to high signal look like they represent areas of cellularity. So a big process here. We're going to put up another view here, a sagittal view looking in profile. Now in this sagittal view, we can see this here, this large lesion in the back of the knee in the popliteal fossa. It's about 11 centimeters from top to bottom. And again, these broad sheet-like areas of low signal look like they represent bands of fibrosis and this other cellular matrix interspersed. So the question is, what is this thing? And as a radiologist, it's hard to say for sure what this is, but we describe, is it well-defined or poorly defined? And is it infiltrative? And now in this case, it's poorly defined. We don't see sharply defined margins. We do see it infiltrating the medial gastrocnemius muscle, also lateral gastrocnemius a little bit, so it goes right into the calf muscle. So it's a large, poorly defined, infiltrative lesion. And so we cannot say that this is benign. It looks like this could be malignant. And when we see these broad sheets of low signal and we don't see any fat within it, we think about a fibroma or maybe a fibrosarcoma. So either a benign lesion like a giant infiltrative fibroma could look like this, and also a malignant lesion like a fibrosarcoma could look like this. Sometimes you can have other sarcomas that become undifferentiated. They can degenerate and look like this as well. So in the end, we just have to say this is not well defined, it's large, it's infiltrative, it's non-specific. This could hopefully be a benign, infiltrative fibroma, which would be great, or it also could be a, fibrosarcoma. So they're going to have to do a core biopsy of this and figure out what this is, and then remove it no matter what. But that's it. Thank you very much.